My name is Flavio Oliveira. I'm a neuroscientist at the University of California, Berkeley. I'm studying how people make decisions by looking at one of the most common decisions people make in everyday behavior, which hand they're going to use for an action. This happens hundreds of times during the day, where you decide that you're going to use your right or left hand to press an elevator button, for example, or pick up an object. And we don't normally think about this decision-making consciously, but our brain has to process a whole lot of information in order to make those decisions. In our experiments, our participants play a little game in a virtual reality setup where they have to reach towards targets with their hands, and they have to make a choice on whether they're going to use their right or left hand. And when they're doing this, when they're just about to make a decision, we stimulate their brain with this technique called transcranial magnetic stimulation, or TMS. What TMS does is it creates these magnetic pulses that penetrate the skull and hit the brain non-invasively and harmlessly, but it induces electrical activity that disrupts the function of a particular brain area that we're targeting. And as we stimulate participants' brains, they end up choosing to use one of their hands more often. So essentially, by stimulating the left side of the brain, for example, we're disrupting the planning of the right hand and making people use their left hand more often. So the future for our research, and hopefully other people's research based on our current findings, is that perhaps we can use different stimulation techniques to do rehabilitation of patients with neurological disorders such as stroke, or even just a better understanding of how decisions are made can help physical therapists, for example, develop better rehabilitation regimes to work with these kinds of patients. This is just the first step.